Your bladder could hurt post-COVID all by itself with or without the endometriosis. Let me show you this article from 2022, the effect of COVID-19 severity on lower urinary tract symptoms manifestations. As a women's health physical therapist, I have absolutely seen increased bladder pain in my patients, and they have gone to the doctor and they do not have urinary tract infections. And so it's as if they have a non-bacterial cystitis. So they have cystitis, so they have irritation of the lining of the bladder. So in this article, they go on to say the dominant symptoms in the patient with COVID-19 are symptoms of respiratory organ systems such as cough, runny nose, shortness of breath. But we know as women that the gynecological urinary symptoms are really just as important as the cough that people talked about. So urinary frequency related to the infection of COVID-19 virus was also reported. However, the association between COVID-19 infection and lower urinary symptoms are still unknown. In this particular study, they aim to identify the effect of COVID-19 on the lower urinary tract system. This particular study had male and females, and they were looking at the International Prostate Score, which for women, that's not the best scale, but let's keep going. So they had 606 COVID-19 confirmed patients in this study. In their conclusion, they say that those 606 people reported frequency, urgency, and nocturia. So obviously going to the bathroom at night. These lower urinary tract symptoms may increase in severity with the severity of the infection of COVID-19. The severity of COVID-19 has a significant effect on the increase of lower urinary tract symptoms. Now, let's go deeper into the article. So in their discussion, they talk about the respiratory symptoms are the most common COVID-19 symptom people think of. However, one of the early symptoms could be lower urinary tract symptoms. So based on the research in this study, it was found that the prevalence rate of lower urinary tract symptoms in COVID-19 patients was relatively high. They go on to say that men are susceptible to this too. There is increased age is also found to increase the incidence of lower urinary tract symptoms. They saw that men and women over the age of 50, it was significant. The real take home is the possible mechanism of how viral cystitis occurs is due to the ACE2 receptors in the epithelial urinary tract. ACE2 receptors. The ACE2 receptor is an essential receptor for the SARS-CoV protein. So endometriosis, not fun, totally hurts. Endometriosis living like a top hat on top of your bladder, not fun. Endometriosis with maybe a connective tissue disorder, maybe mast cell disorder. Then you put COVID on top of that, which is an inflammatory disorder, and now you feel like garbage. But